What are the most recent improvements in Alzheimer's treatment? Numerous old individuals experience the ill effects of Alzheimer's sickness. What treatment techniques are accessible? Current Alzheimer's medicines add to further developing side effects of cognitive decline and issues with thinking and mental judgment in patients by improving the presentation of synapses in the mind that send data starting with one nerve cell, then on to the next. Be that as it may, these medicines don't stop the weakening of synapses. And as additional cells pass on, Alzheimer's infection proceeds to advance. And the condition slowly deteriorates and side effects become more serious. Alzheimer's treatments that can halt or significantly slow the disease's progression are being developed, according to experts. The rising comprehension of what the infection means for the cerebrum has prompted an endeavor to foster medicines that attention on the essential neurotic system of Alzheimer's. It is conceivable that these future medicines will include the cooperation of a gathering of medications, some of which depend on how various kinds of dangerous growths or HIV are dealt with. The accompanying treatment choices are among the main procedures presently being examined to treat Alzheimer's, focusing on plaques and extraordinary brain structures. A few new Alzheimer's medicines target infinitesimal designs or plaques of the beta amyloid protein. These plaques are a sign of Alzheimer's sickness, and procedures that target amyloid beta protein include 1. Improving one's immune system. Few meds, known as monoclonal antibodies, are accessible. These meds work to keep the beta amyloid protein from gathering as plaques or eliminate these plaques from the mind. Monoclonal antibodies imitate antibodies that the body delivers normally. As a component of the resistant framework's response to unfamiliar bodies or immunizations. For the treatment of some cases of Alzheimer's disease, aducanumab was approved by the FDA in June 2021. It is the primary medication endorsed in the U.S. of America to treat the primary drivers of Alzheimer's illness. By focusing on and eliminating amyloid plaques in the mind, the Food and Medication Organization supported the utilization of this medication, relying on the prerequisite that further examinations are directed to affirm its advantage and distinguish patients who benefit from it. Lecanemab has shown the capacity to eliminate amyloid and is currently in stage 3 clinical preliminaries, as well as the promising medication donanemab, which is additionally in stage 2 clinical preliminaries and will move to stage 3 soon. 2. Forestalling harm and obliteration of synapses. A medication created as a potential malignant growth treatment, called saracatinib, is currently being tried to treat Alzheimer's illness. This drug reversed memory loss in mice by blocking a specific protein, as demonstrated by experiments on mice. This allowed synapses to function normally again. Human preliminaries are currently in progress for saracatinib as a possible treatment for Alzheimer's illness. 3. Blockers of beta amyloid protein creation. These medicines might lessen how much beta amyloid protein framed in the mind. Research has shown that beta amyloid protein is created from a parent protein in 2 stages with the assistance of various chemicals. These enzymes are the targets of many experimental medications. They are known as beta and gamma secretase inhibitors. Ongoing examinations have shown that beta secretase inhibitors didn't slow mental deterioration and caused many aftereffects in individuals with gentle or direct Alzheimer's sickness. This prompted a diminishing in excitement for the system of activity of this medication, and an emphasis on different medications. From this gathering, preventing the formation of nodules by tau protein, the vehicle framework between synapses stalls. When a protein assembled tau clusters into tiny strands called knobs, which is one more strange peculiarity normal in patients with Alzheimer's. Tau total inhibitors or tau immunizations are presently being considered by means of clinical preliminaries. Diminish aggravation. Alzheimer's causes ongoing, poor quality aggravation in synapses. So researchers are searching for a method for addressing the fiery cycles that add to Alzheimer's illness. Research is presently being led on the medication sargramustine. This medication is thought to boost the immune system's ability to shield the brain from harmful proteins. Researchers explored the diabetes drug pioglitazone actos to decide if it lessens beta-amyloid protein and mind aggravation. Yet, they tracked down no huge viability for it. Research on insulin obstruction. Researchers are looking into how insulin affects the brain, how cells in the brain work, and insulin changes in the brain that might be linked to Alzheimer's disease. However, a trial of a nasal insulin spray found that it did not significantly slow the disease's progression, so research in this area is still ongoing. Concentrate on the connection between the cerebrum and cardiovascular capability. Developing proof proposes that cerebrum well-being is firmly connected to cardiovascular well-being. It appears to be that the gamble of creating dementia increments because of numerous medical issues that influence the heart and conduits, including hypertension, coronary illness, stroke, diabetes, and elevated cholesterol. There are a lot of studies that do a better job of looking at this relationship. The most important strategies that are being studied are the connection between coronary illness, drugs, and Alzheimer's infection. Researchers are concentrating on whether hypertension meds used to treat vein sickness may likewise be gainful for individuals with Alzheimer's or decrease the gamble of dementia. Distinguishing other medication focuses on extra examinations. Look all the more carefully at the connection between the cerebrum and the heart at the subatomic level to recognize other medication focuses for existing medications. Modification of one's lifestyle. According to studies, adopting heart-friendly habits, like regular exercise and a heart-healthy diet may aid in the prevention of Alzheimer's disease or delay its onset. Hormones. In one review, taking estrogen-based hormonal medicines for basically a year during perimenopause or early menopause was found to safeguard memory and thinking in ladies in danger for Alzheimer's sickness. In any case, studies have arisen that contention with this thought, showing that estrogen gave no advantage. Consequently, we want more exploration to, all the more likely, comprehend the connection among estrogen and mental capability before any suggestions can be made. Speed up the advancement of treatment. Growing new medications is a sluggish and relentless interaction. The speed can be baffling for individuals with Alzheimer's illness and their families who are hanging tight for new treatment choices. The Alliance Against Major Diseases (CAMD), an alliance of pharmaceutical companies and non-profits, has established a first-of-its-kind company to share data on Alzheimer's disease clinical trials in order to speed up the discovery of new medicines. Researchers expect that normalizing and sharing information from an excess of 6,500 distinct examinations will speed up the improvement of additional compelling medicines.